Hello, my name is Dr. Joshua Eastvold. I'm one of the emergency medicine physicians here at Mercy Hospital in Iowa City, and one of the co-medical directors as well. We decided to do this piece just to talk a little bit about COVID-19 and safety in the emergency department. Since this pandemic has started in 2020, the fear among the community as well as really everyone has been high. I mean, 2020 has been a tough year for everyone. One of the things that we've seen over time since the pandemic started is this fear of coming to the emergency department and catching COVID-19. In doing that, what's happened is patients are presenting later in their disease course, unfortunately. So since March, the emergency department has seen patients that are presenting late in their disease course, such as strokes, heart attacks, serious infections such as appendicitis, diverticulitis. And because of the delayed presentation, some of these patients, unfortunately, are having poorer or worse outcomes. And we felt that this message was important to get this out to the community so that patients are seeking the treatment that they need. If you have an emergency, you got to come into the emergency department right away. And this fear of catching COVID-19 is warranted in terms of the fear of the pandemic. But coming to the emergency department, your chance of getting COVID-19 is extremely small. And the reason that risk is very small is that we do everything possible to mitigate that risk. We are experts in infectious control. We isolate patients upon arrival to the ED and get them away from the rest of the patient population. Every patient's masked, every visitor's masked. We revamped our entire ventilation system in the ED to help minimize that risk as much as possible. And anecdotally, we haven't had any exposures or cases that we know of, and the literature supports that as well. There's a recent study that came out in Portland where they looked at the chance of getting or the risk of getting COVID-19 in their EDs, and they determined the risk is extremely small and much less of a risk than going to other places in the general community. So one of the main messages that we wanted to get out was if you think you have an emergency, whether it's chest pain, stroke symptoms, fever, difficulty breathing, and you would have gone to the emergency department before the pandemic, we want you to come in and see us. Because if you delay your care or your presentation, that could have more detrimental consequences down the line. So to summarize, for heart attacks, stroke symptoms, and other emergencies, don't delay your care. Seek the emergency department because that difference could be a difference between life and death.